And despite parts of the government shutting down, the Affordable Care Act will move forward. Registration begins today, so people who don't have access to job-based health insurance can now start shopping for subsidized private policies.
Lower cost plans may come with a lower premium, but they may come with a much higher deductible as well. So people will have to make those trade-offs and calculations.
Health and Human Services Secretary Kathleen Sebelius says she will consider the program a success if at least 7 million people are signed up by April. Now, we know that many of you have a lot of questions about enrolling for this insurance.
That's right. We want to bring in Ann Filippic, who is the president of Enroll America. That's the nation's leading healthcare enrollment coalition. Good morning, Ann. Let's begin with what exactly is happening today.
Good morning, Michael. Well, our Get Covered America campaign is all about spreading the word that starting today, there's a new way to find health insurance that fits your needs and meets your budget. The health insurance marketplaces launched today, and at these marketplaces, the 4.9 million uninsured in Texas are going to be able to find a place where they can go compare their plans and find these new quality, affordable health insurance options.
So if you're a person who does not have health insurance, what do you need to think about? Maybe do you need to write down some things before you go to the marketplace?
Well, I think the first and most important thing to know is what's featured at the health insurance marketplaces. And there's some big life-changing information for the uninsured folks out there. The first is the fact that all the plans featured at the marketplace are required to cover the essential benefits. These are things like trips to the ER, prescription drugs, maternity care. It's also important to know that you can't be denied because of a pre-existing condition. So for folks who in the past, maybe they have a history with asthma or even cancer and they didn't get the care they needed because of that. This is a new day and you can't be denied because of that now. And the other really important thing to know is that financial assistance is going to be available to many folks. So for the first time, this really is going to be within reach for millions of people.
And when is the deadline that you need to decide on your policy?
So you have some time. This is really the beginning of a process. So if you want your coverage to begin January 1st, you have to enroll by December 15th. However, you have until March 31st of next year to go ahead and enroll if you want to take a little bit more time.
All right. Thank you, Ann. It's been really nice to know what the costs of these new plans versus what they were prior to the Affordable Care Act, but we'll work on that. Our sister station in Austin will be holding a town hall on Thursday to discuss the Affordable Care Act. We will be streaming it live on news4sa.com from 6 to 7:30 Thursday evening.